Welcome to a new episode of Science in Context. I'm Sabine, and this week Ruth McCabe and Dr. OJ Watson join me to speak about alternative data sources to track the impact of COVID-19 in areas with limited surveillance. Ruth, what type of data sources are ideally used to track COVID-19?
Officially reported cases and deaths allow us to track the spread and burden of COVID-19. However, these data relied on testing infrastructure, and deaths also required vital registration systems. When cases and deaths are not detected, we can use seroprevalence surveys. These are surveys of the general population which show antibodies and thus previous exposure to the virus that causes COVID-19.
Settings with limited resources do not always have these types of data available. OJ, your study looked at alternative sources. Can you explain a bit more?
In our study, we considered three different settings. In Addis Ababa, in Ethiopia, we used records of burials kept by cemetery workers. In Aden, in Yemen, we relied on satellite images of cemeteries to estimate the number of deaths in these settings. And lastly, in Khartoum, in Sudan, we used social media conducted surveys of symptoms to estimate the number of infections over time.
Ruth, what were your main findings?
So by incorporating these data within a mathematical modelling framework and validating our estimates with seroprevalence surveys, we found that between 69 and 100% of COVID-19 deaths were reported in Addis Ababa, but this was between 1 to 8% in Aden and 3 to 6% in Khartoum.
OJ, what does this mean for future pandemic planning in these regions?
We validated the suitability of using these data sources as an alternative to officially reported data. In doing so, our findings contradict the hypothesis that countries with limited resources were spared the worst of the pandemic. However, these data sources are not a replacement. The global community must prioritize providing support and investment in the development of vital registration systems to capture all-cause mortality across the globe. Better vital registration is not only essential for future pandemic preparedness, but is also foundational for evaluating progress made across multiple areas of public health.